For my career assignment, I chose to talk about nurse practitioners. Nurse practitioners are a type of advanced practice registered nurse who specialized education and clinical training that allow them to provide a higher level of care and to perform a variety of tasks that RNs are not licensed to do. They focus on specific areas or populations, including pediatric, geriatrics, and mental health and adult medication. They usually complete an advanced degree program that allows them to practice independently and take on roles similar to that of a doctor. NPs usually start as registered nurses and then move on to get their master's and sometimes their doctoral degree. A Master's of Science in Nursing is the minimum degree requirement for becoming a nurse practitioner. There are minimum qualifications that are also required to become an NP. You must graduate with an accredited school of nursing, graduate of an accredited nurse practitioner program, current advanced practice registered nurse license, current nurse practitioner certification in a specialty area, current CNOR or CRNFA certification, current provider card in basic life support and advanced cardiac life support. Past provider card are required by department and faculty. You also must have strong computer skills, including Word, Excel, PowerPoint, and be eligible for hospital privileges. Nurse practitioners are generalists who work in family health clinics or hospitals, providing general and preventive care, treat illnesses, conduct checkups, order lab tests, and even prescribe medication to both children and adults. NPs help with all the aspects of patient care, including diagnosis, treatment, and consultations. They can also work with both inpatient and outpatient situations with a treatment team or independently. They have many responsibilities. These can include performing physical exams, patient observations, monitoring and operating medical equipment, diagnosing health issues, administering medication and other treatment, consulting with healthcare professionals and families. NPs are also in charge of ordering, administrating, and analyzing diagnostic tests, creating patient care and contributing to existing ones, or detecting changes in patients' health and modifying treatment plans as needed. There are a national-wide increase in demand for nurse practitioners. Lies with the aging population, an increase in team-based primary care delivery, and pending shortage of primary care physicians. NPs are needed within every state in the U.S., but some states are in high demand. These high-demand states include New York, California, Florida, Texas, Illinois. According to the State Bureau of Labor Statistics, NPs are needed in hospital outpatient settings and private practice around the U.S. According to the Bureau of Labor Statistics report, the mean annual wage for nurse practitioners was $115,800 in May of 2019, with those who worked in hospitals earning the most. Each state highly yearly means wages for nurse practitioners all vary. The average salary for a nurse practitioner is $108,000 per year in Ohio. NPs are often enjoy additional benefits like flexible work schedules, educational opportunities, and even child care services. There are many aspects that I would like to be about being a nurse practitioner. I would enjoy being able to make differences for individuals in the community. Also, being able to work directly with patients and make a positive impact on families is enough to get me back to work every day. Being able to answer these questions and concerns so I could offer them a preventative care and help them be healthier. Lastly, being the one who is in charge of decision-making process is the one I would like to help develop their treatment plan for patients is a great aspect to the job. I like that NPs are able to partner up with a patient and get them the highest level of wellness that they need to achieve. A couple more aspects I would like: that you could travel the country, make good money, and choose a certain specialty and learn something new about the job every day. There are also many aspects of NPs that I believe I wouldn't like doing, especially during certain environments. NPs are undervalued by patients because they mostly believe that nurses are not trusted and that they would rather have a doctor help them instead. Also, aspects like having a difficult coworker, patient, and working conditions, along with the emotional strain, stress, and physical demand it could take, can be a disadvantage to the job. Exposure to germs in hospitals and doctors' offices can sometimes be a disadvantage because you have constantly wash your hands off and on during your shift.